Mia, hello.
Hello, how are you?
We're good. Thanks for doing this. Welcome to your cardiac scenario. You'll have 12 minutes on the clock. We're going to begin from the moment you're dispatched to the moment you're giving a radio report. And like I said earlier, I'm not going for perfection. I'm more going for a display of how you flow through the assessment, as well as how you ask for certain things. And these are things that don't come naturally to our students earlier in the class. And so we're just trying to provide examples of what that could look like. All right. This is cardiac. You are dispatched to the residence for the patient complaining of chest pain and respiratory distress. Go for it.
Okay, so first I am going to begin with proper PPE.
Okay.
Is the scene safe?
Scene is safe. You're in a residential block, and it's quiet. It's a Sunday afternoon.
Okay.
And as you approach the residence and knock on the front door, a gentleman says, "I'm in here."
Okay.
And as you approach the gentleman, you notice him sitting on a chair, leaning forward. One hand is on his leg, so he's like leaning forward, and then the other hand is on his chest like this.
Okay.
And his eyes are open. He's looking at you. He actually says, like, "How's it going? Come over here." But he doesn't speak as eloquently. He takes a breath or a pause every 3 to 4 words.
Okay. I'm going to determine this as a nature of illness. Is there only...
What kind of nature?
I would say cardiac and respiratory, like shortness of breath.
Is it the chest pain that throws that off? Or that points you in that direction?
I would say that the chest pain probably points me towards it being a combination of cardiac and him being shortness of breath.
Okay.
Being a combination of respiratory as well.
Okay.
Is there only one patient?
There is.
Okay.
He's by himself right now.
Okay. I'm gonna request additional ALS.
Okay. On the way.
Okay. And then I'm gonna start the primary assessment. Would you be able to tell me your age and gender?
Yeah. They say, "What's your name?"
Yeah. My name?
Yeah.
My name's
"Who are
Mia.
you?"
Hi. My name's Mia.
Oh,
I
okay.
am going to be your EMT today.
Okay.
I am just going to ask you a couple of questions.
Okay.
Can I have your age and your gender assigned at birth?
Sure. They say, "Hey, Mia, my name is Mark." They are 52 years old and male at birth.
Okay. Can you tell me what is going on with you today? Why
Sure.
you're feeling this way?
Yeah, it was a normal day. I was hopping on my Peloton bike, and I was going for about an hour on the bike. And after an hour, I usually go for 2, but after about an hour, I started experiencing some chest pain and difficulty breathing.
Okay. And then I am gonna ask you a couple silly questions that might seem a bit silly, but do you know your name, like who
Mark.
you are?
Mm-hmm.
Do you know where you are?
At home?
Do you know what date it is?
Sunday?
And you said you were on the Peloton beforehand?
Yeah.
Okay. So he would be A&O times 4.
Okay.
And then I would not consider C-spine stabilization as well.
Okay. Is there a reason, that's kind of pointing you in that direction rather than wanting to protect his cervical spine?
I would say because it's mainly concerning his cardiac and chest area, definitely not near.
So you're I guess what was present or absent that pointed you in the direction of not being suspicious of cervical spinal trauma?
Probably the absence of trauma in general, anything that affected his bodily.
Okay. Okay, I agree.
Put him in bodily harm.
I agree. What's the next thing?
And then I would say that the patient does look sick based off of his presentation.
They're sweaty, but they just finished a workout. But they are a little pale, and then they have to pause every couple words to tell you what's going on.
Okay. So then now I'm gonna start with the ABCs. I'm gonna start with his airway. Can you tell me if there's any airway sounds that are abnormal?
No abnormal airway sounds
Okay,
when he speaks to you.
And then no like obstructions or anything else?
No obstructions.
Okay, I'm going to move on to his breathing. So
Okay.
then would you be able to tell me his respiratory rate and pattern?
Sure. Rate is slightly elevated and pattern's regular. What should we have asked before then?
Tidal volume.
Tidal volume's adequate.
Okay. So tidal volume's adequate, respiratory rate, okay, pattern. And then I'm going to also ask you for the lung sounds and SpO2.
Lung sounds are clear bilaterally, and
Okay.
SpO2 is currently 89%.
Okay. Is there any accessory muscle usage?
No, not at this time.
Okay. And then
89% clear lung sounds.
89%. Okay. So then I would probably start administering an oxygen therapy.
Okay, so you have a couple devices on the table. Which one would you like to use first?
I would probably start him off with, I would say a non-rebreather, 15 liters per minute.
Okay, all right. So he's on a non-rebreather at 15 liters per minute.
Would you be able to tell me his SpO2 after I gave him the non-rebreather?
It hasn't changed anything yet.
Okay,
We just put it on.
Okay. Okay. And then circulation. Can you tell me his skin temp, color, and moisture?
Sure. What also, thinking about trauma, what did we ask in trauma that came before airway and breathing?
Bleeding.
Right.
Yeah.
Yeah.
If
So
there's any exsanguination.
there's no major bleeding, and then you currently asked for skin.
Yes. Skin.
What parameters of the skin did you want to learn about?
His skin temp, color, and moisture.
Okay. Pale, cool, diaphoretic.
Pale, cool, diaphoretic. Okay. So then that is a sign of shock, which I will first ask the rest of the circulatory questions before I apply shock treatment.
Okay.
Can I have his pulse rate, regularity, strength, and equality?
Sure. Weak pulse, fast rate, regular pattern, and equal on both sides.
Okay. Sorry. Okay. So then I would probably give him shock treatment.
Okay.
I would lay him supine on his back and then give him a blanket.
let's say it makes it harder to breathe when he's on his back. Is it okay if he lays in a position of comfort?
Yes.
Okay.
Okay.
And then you said oxygen, and then keep him warm.
Yeah.
Okay.
Keep him warm. It seems as though he would be in respiratory distress right now, based off of his signs and symptoms.
Okay.
Okay. And then now, is there any hypothermia, hyperthermia that I should be aware of?
It's currently 72 degrees in the house, about 76 degrees outside, and to the touch, he's just cool to the touch.
Okay. So I would say that's fine. I am probably going to package him for transport.
Okay.
Then I will ask the rest of my focused assessment questions once we are in the rig.
Okay. All right, we're in the rig.
Okay. I'm just going to ask you a couple of questions. Are you having any chest pains? Any trouble breathing right now? Shortness of breath?
Yes to the chest pain. Yes to the shortness of breath.
Okay. Are you known to have a respiratory infection as of right now, or a history of respiratory infections?
Nope, not at this time. No fever or anything like that. No cough.
Okay. So then, are you taking any erectile dysfunction medication?
Not at this time.
Okay. I'm gonna look for a JVD.
Okay, not noted.
Peripheral edema.
Not noted.
Is there any lip pursing when he's breathing? Any frothing at the mouth?
No pursed lip breathing. No pink frothy sputum.
Okay. Okay, so then I'm probably gonna move on to his probably general history taking questions.
Okay.
Would you be able to tell me if this started more suddenly, or was it something that happened more prolonged?
Yeah, it was pretty sudden.
Sudden.
Yeah.
Would you be able to tell me if there's anything that makes it better or worse when you're breathing? Any deep breaths that you take? Does it hurt when you take deep breaths?
No, it doesn't hurt when I take deep breaths, but it doesn't seem like anything's helping. I mean, the oxygen's kind of helping, but in general, before you got here, it seemed like it was just getting worse.
Okay. Can you describe your pain to me?
Yeah, it feels like a pressure, like someone's sitting on my chest.
Okay. Can you tell me where? Even though I'm guessing it's probably on your chest, but
Yeah, it's right here on the left side.
okay. Can you rate it 1 out of 10?
Yeah, at the moment, probably a 7.
Okay. And how long ago did this start occurring?
Like 20 minutes.
About 20 minutes. Okay. Do you have any allergies?
No allergies.
None. Medications that you're taking?
Lisinopril and metformin.
Okay. And then what? Do you know your like past medical history? Like any, like you know,
Yeah. Sorry, he also takes a daily aspirin.
daily aspirin.
Yeah. But he has.
Did you take it today?
He did. He takes. So his medical history includes hypertension, diabetes, a previous heart attack, maybe like 7 years ago. And then he's like, wait, I think I also take nitro.
Okay. Okay. What was the last thing that you ate today?
Made a sandwich for lunch
Okay, sandwich.
a couple hours ago.
And then you were on your Peloton before this, correct?
Correct.
Can you tell me the blood pressure, pulse, and respiratory rate?
Yeah. Blood pressure is 82/38.
Okay. And then pulse rate?
Pulse rate is 106.
106. Okay. And then the respiratory rate?
About 24.
Okay. And then the SpO2 right now?
SpO2 is 94.
94. Pupils?
Pearl.
And then for the aspirin, did you take one tablet, 2 tablets, 2 tablets?
Took one.
You took 1 tablet.
Correct.
Okay. And you have no allergies.
Correct.
And you took nitro?
No, did not take nitro.
Okay. I would probably give him 3 more tablets of aspirin because he has a lower blood pressure, so I probably wouldn't give him that because it could kill him.
Yeah. So what's your total dose for aspirin that you're aiming for?
324 milligrams of aspirin. So
Right.
then,
And
since he took
what's
one,
the route he takes it? How would you coach him to take it?
I would just coach him to take it orally, put it in his mouth.
He has to chew it too.
Yeah.
Yeah. Okay.
Okay. I will give
If
my
you were
rating.
to help out with nitro, how would you help him out with nitro?
I would tell him to put it underneath his tongue.
Okay.
Okay.
All right.
Okay.
But you said in this case you wouldn't give nitro.
Yes, I wouldn't give nitro based off of his blood pressure because if you give nitro with with the low blood pressure, it could possibly cause it to go lower, and then it could have some serious contraindications.
Consequences.
Yeah, consequences.
So,
sorry.
what would your field impression be?
I would probably say that my field impression was
In this case, it's either stable or unstable angina. We can't confirm or deny a heart attack.
yeah. So I would just say unstable.
Okay. Well, that's determined by the onset. Did it come on via exertion and stress, or did it come on at rest? And then any alleviation? Is there any relief on rest or medication? And it kind of makes sense that it came on via exertion, like a Peloton. But how is it currently with any relief, like with the medications and interventions that you're providing? And so with oxygen, it was slightly helping. We didn't reassess yet.
Yeah.
I wouldn't expect it to be relieved solely from aspirin. And I agree with you, the systolic blood pressure is below our prereq for nitro. So I wouldn't expect a huge amount of relief, but I would consider stable.
Oh, stable? Okay. Very stable in general. Okay, and then...
What would your, how often would you reassess, and what would it include?
Every 5 minutes, and then I would, like, probably reassess lung sounds, basic, like, vitals, like blood pressure, pulse, respiratory, SpO2, and then just, like, ask him his, like, chief complaint again, and then, yeah.
When you're ready, go for a radio report.
Okay, this is Chicago Ambulance 17, BLS. We are about 15 minutes out. Do you copy?
Loud and clear.
Okay, we are en route with a 52-year-old male with a chief of chest pain, respiratory distress, A&O times 4, no current allergies, medication is Lessipro and I don't know how to spell.
Lisinopril and metformin.
Okay, Lisinopril and metformin. Currently took...
And nitro, sorry. That was the last minute. Yeah.
Okay, that's where I got it. Nitro, medical history of diabetes, heart attack. Last oral intake was a sandwich. Event leading up to this was he was riding on his Peloton. BP was 82/38. Pulse rate was 106. Respiratory rate was 24. SpO2 89. But then after intervention, it increased to 94. Lung sounds were clear. Pupils pearl. And then the treatment that we gave was 3 tablets of aspirin. Are there any other questions?
So they said you withheld nitro?
Yes.
Okay.
And we withheld nitro. Yeah.
Is that it?
That's it. Do you have any other questions or concerns?
No. See you when you get here.
Okay.
So how'd you feel?
Definitely a little nervous because this was my first time doing a cardiac assessment in like
a
bunch of weeks, and like I was expecting to do a respiratory one.
Oh, my bad.
No.
Wait, so it was because we had a solid respiratory one in the last class.
Yeah. So
there's some overlap.
Yeah, but I feel like it was like definitely great practice to have before the like final practical with like everything that's like medical and trauma. Mm-hmm. So definitely gave me a good refresher.
Okay.
Gotta like brush up on my medications and like probably treatments.
The associated signs and symptoms would have included like weakness, dizziness, palpitations. Mm-hmm. You did OP-QRST ample correctly. You asked for a respiratory infection. I wanted to hear about the cough and then whether or not it was productive. You did ask if the pain changed when I took a deep breath or not. And then another look for secondary skin conditions in the focus assessment, but you asked for JVD, peripheral edema, pursed lip breathing, pink frothy sputum.
Did I really not listen to lung sounds?
Again, you did it in the breathing section.
Oh, okay.
Right? Clear bilaterally. Mm-hmm. And then blood sugar. Other than that, that was what I wanted to get out of this. Mm-hmm. So for anyone watching, like this is how we would like you to ask and assess a patient in your first practical. And many students just can't grasp that. And so I hope by us going over it, as well as you seeing how the assessment is scored in live, is helpful. So Mia, thanks for doing this. If you were to reflect on your journey, because I noticed you had a slow start. So you really latched on to the grasp of things. You grasped the material, I would say, starting with Unit 3 in neuro and abdominal and immunology. Yeah. What do you think was the tipping point for you to start grasping it?
I would probably have to say after like the first practical and then after the first couple of weeks of it really picking up pace, because it like started off slow, but then like it was really sudden. Like we just started like doing practical after practical exams, and I felt like that after like pretty much taking the first like practical as a whole, I kind of like realized that I needed to start putting in more like effort studying, asking questions, probably participating more when it came to like smaller groups and like everything like that. Mm-hmm. So
is there anything that we could have like done for you besides just talk about how much work goes into it that would have helped you realize that earlier on in the class before? Because like I don't want you to have to go through zeros in order to have this realization. So like what else can I do to help that student realize this?
I would have to say that like it just depends on the student and like the way that they are able to learn, because like there are some students that will like pick up on you telling them that like you have to take this seriously, you have to like start like studying, start like actually like understanding like how fast it goes, while like some have to kind of get those zeros and kind of get kicked to the curb a couple times before they finally realize it. And sometimes it ends up with them realizing it a little too late, and that's when they end up failing the course. And so it just like really depends on the student and the way that they are willing to put in the effort and the energy to really take this class seriously, because it does take a lot of time and effort.
I wonder if there are any exercises that we can do at the beginning of class that helps you become self-aware of what type of student you are.
I would have to say, I feel like that what would probably be better is maybe a little bit more like practice practicals, but like, maybe have them be worth a little bit less.
18 points is not a lot, though.
Yeah, I
and
know.
Usually it's just like participation.
Yeah, exactly. So
and the difficulty in that is you don't know what signs and symptoms are, are associated with certain chief complaints that early on in the class. So, as hard as it is to even run you through scenarios, I can't imagine how hard it is to like, if you were to find a study buddy and practice with each other and you don't know what responses you should be giving.
Yeah, so I don't like really know, because at least for me, my like way of like studying and like having to like realize like you like have to take it seriously is probably getting kicked to the curb a couple times, getting knocked down a couple times, because I feel like that just, it like almost like motivated me to like put in the effort and like take this as like, I don't know, like my job, like,
I know.
I am responsible for like how I do, so I have to.
Yeah, I know. And it's like, how do you can't force someone to be accountable.
No, literally, which is like what I've learned. So like, it's just based off of their energy, effort, and how much that they're willing to put into achieving what they want. There are people that won't put in the effort, and there are people that will put in the effort. So it just depends on their mindset and their goals and how far and how much that they're willing to like incorporate to reach those goals.
Yeah, couldn't have said it better myself. Mia, thank you.
Yeah, of course.
You will live in perpetuity on YouTube. So thanks for doing this. I think it will be helpful to anyone watching.
Yeah.
Thank you.
Yeah, of course. Thank you.
All right, I'm just going to get a